So COVID-19 has created a new reality that includes what we're calling social distancing. So we're allowing for some distance between me and my guests as well. We are respecting the protocols. Communication specialist Karen Dumas is off to my left. PR and political strategist Greg Bowens is 6 feet away from her. Brandon Brice, who's host of Straight Talk on 910 AM Superstation, is across from them. And Kerry Leon Jackson, also known as the Urban Conservative, is here as well. Thank you to all of you for being here. And I hope that you all are taking care of yourselves and your families. This is a really scary time. I mean, every day I wake up and wonder what will happen today that I never anticipated would ever happen in my life. Karen, I'm going to start with you. You had some thoughts before the show about what we're learning about ourselves because of this pandemic.
Yeah, I think that we are seeing a lot of the voids that exist structurally, socially, economically, educationally, that should have already been on the radar of those who are responsible for those areas. We were talking about kids having to go to school to be fed. I mean, that's an issue. The issue with the water here in the city of Detroit, you know, I mean, now all of a sudden shutting people off, but we can turn it now on for temporarily for $25. People that are working that don't have adequate coverage, if in fact they're sick, paid time off, childcare, all of these issues, it shows that we have been out of sync for so long. So I'm hoping this will be the opportunity for us to come back and do things differently and in a better way.
Yeah, I mean, I hear people say, Greg, the government is about to come up with $3.5 trillion to deal with this epidemic in either medical or social or economic ways. Where was that money just a few months ago when, I mean, things didn't look that great for a lot of people in this country. I mean, this idea that we can mobilize so quickly and effectively, I think is a little grating on people who have been left out and are waiting for opportunity to show up in their lives anyway.
I believe that's a really good observation, Steve. You know, in a pandemic, everybody becomes a socialist.
right?
You know, we start pooling all of our resources together in order to help everybody, you know, not just the most vulnerable among us, but each other. And that, I think that's what we're sort of seeing now. This particular situation, as Karen was pointing out, shows the vulnerabilities, but it also strikes at the very heart of what we had started to become, which is a very narcissistic sort of country. You know, me first over everybody else. And I think that, you know, what we are having to face together is this idea that even though I'm healthy and I feel okay, it's still my responsibility to not give a party at the crib and have a bunch of people come over and where they can go back out and potentially, you know, make other people sick, whether that's grandma or whether that's, you know, a niece or a nephew or a stranger who happens to have, you know, a heart condition or is recovering from kidney transplant or whatever it might be that's infecting their immune system or impacting their immune system. And so asking people to be less self-centered is, you know, I think a unique challenge for us as a country that maybe they don't have in other places because they're used to sharing in different kinds of ways. And so that's why it was so disappointing to see this week, Stephen, the state Senate, you know, holding their regular session and all these old white 60-year-old dudes up there congregating and hanging out with each other. And we're looking at TV like, hey, man, I'm at home trying to make sure you don't get sick and die.
Right.
And you
Why
up
are
there
you doing that?
hanging out like it's a party. You know?
Brandon?
You know, I think it's interesting. You know, the last time America experienced something like this was maybe the Great Depression. I mean, I don't think the country has realized the state of where we are, which is why you still see people in South Beach and still see people traveling. The challenge, I want to go back to Karen, is that I think, one, I don't think it's really resonated what's happening right now. People look at the common flu and they say, okay, it'll be over in a couple of weeks. When we look at other nations, Newt Gingrich, who's in Italy now, just came out with a statement to say, this has to be taken seriously by the American people. And he's there where I think there's 7,000 now. And so now the challenge is, one, how do we get people to understand that the social distancing should be mandated. It should not be something that they should take lightly. But also I want to go back into it. This situation is proving that there are some very serious systematic ills where We're talking about obviously the haves and the have-nots. We're talking about poverty. We're talking about the fact that seniors are now in a very vulnerable position. And so now I think at the end of this, if we can get through this in 3 weeks, as the Surgeon General says, we might get through it, maybe not.
Yeah.
I think America has to really look at how do we move forward and what are the ways we can patch up some of our social ills.
Yeah. Kerry?
I don't know about becoming a socialist. I think actually it's more of we should have had better conservative leadership at the beginning of January and at least in the third week of January. There's absolutely no reason. We had a natural barrier where the disease was not in our country from shore to shore. There was no reason that the first thing that should have occurred is the president not just should have told one boat, I don't want those people coming on shore because they're going to infect everybody else. You should have told all of those folks that, I know they're Americans, but you should have said, we're going to send you somewhere else and treat you somewhere else because you're not about to bring that on our shore. You should have told all of those Americans that were overseas who all rushed back home to bring back their infected selves and infect the rest of us, me, grandparents, and everyone else. Should have told all of them, we're going to wind up, even though we're going to have to pay to put you up somewhere else, we'll put you up somewhere else, but you're not about to bring that disease here.
So you think we could have
controlled it?
You think we could have isolated from it? I don't know. I don't know if I think that it works quite that way.
The president.
Pandemics, diseases work that way. If in fact if you're clean from shore
But
to
has there
shore.
has there ever been, I mean, an opportunity to make sure something doesn't, something like this doesn't
you might not
come to a certain part of the world?
You might not have 100% eliminated the folks that were here, but what you would have done, the entire purpose of shutting things down now is to flatten the curve.
Yeah.
Because I don't know if Americans know this or not, but hospitals are not allowed to add more beds without getting state approval.
Right.
You're
Although
not
they're
allowed
waiving
to
a
get
lot
it.
of that right now.
All right. So the problem is that if everybody gets sick at one time, the system's going to be overloaded.
system
We
is
don't
more.
have.
But we also don't have the testing capabilities.
We don't
now,
have-
China was able to contain it because they tested everybody
Right.
and they quarantined those who had it until they were well and everything is fine. We don't have those systems
socialist
in place
country.
to do
We
that.
should have contained it before. But since we haven't,
Stephen, let's also look at, China, we're talking about a totalitarian state. When the state tells you stay in your homes, people stay in their homes.
Yeah.
Here, the governor has said many times, isolate yourselves, stay local. We got folks still hanging out.
Yeah.
And if the malls were open, people would still be at the shopping mall.
There's no way in a free society. Everyone's looking at Karen, and when he mentioned the mall, she wouldn't be in the mall now.
No,
I'm giving
I would not.
her credit. But in a free society, this idea of keeping people out of the country, I think, is antithetical to who we think we are, and of telling people what they can or can't do. It, again, bumps up against like what we think America
free society,
is.
your right to travel any place,
Yeah.
it does not interfere with my right to not
I
get
agree with you.
infected.
I agree with you, but I think that most people don't feel that way.
Gulags in a second here. But not only did the Chinese say, everybody's got to stay home, but they gave everybody
people
a mask
masks, yeah.
and said everybody wear a mask. So that if you're coughing, you ain't coughing
Right.
on me, and if
Right.
I'm coughing, I'm not coughing on you. But this is American Black Journal, and so I think it's really important for us at least to talk about how this can potentially, how it does impact the Black community,
Right.
because we can be the most vulnerable when it comes to these kind of outbreaks because we don't have access to health care, and those
First
kinds of
people
things.
laid off.
Yeah.
Right. First people laid off and
And
all
in fact, I want to get into that
Yeah.
in the next segment
Okay.
because I think there's no question that this will look different for us than it does for everybody else, just like everything else does. So let's go ahead and talk a little more about how this looks to African Americans. I wanted to talk in the second section a little about the election, and we'll get to that too. But I want to talk about African Americans. As you say, the extent to which people will be sick is going to be greater for African Americans, and the economic consequences are going to be higher. Let's start with you, Kerry.
The one thing that needs to be said is that right now we're dealing with a state of panic. The other night, the president attempted to. The purpose of a presidential address is you're supposed to go on and calm a worried
Reassure
nation.
people, right?
He went on and he scared all of America, Black and white America. And you can tell that if you watch the stock tickers every day when he's speaking, you see the numbers drop the very second that he starts to speak. And we've learned that the only person in the federal government that anybody trusts at this point is Dr. Anthony Fauci.
Right.
Our community has to stop listening so much to internet rumors and flat out lies about what can and can't occur. But as Karen started saying earlier, it's the one good thing that's coming out of this is we're all going to have to learn to live a little bit more responsibly, and not, because the truth is, in our community, we regularly interact with people who have active infectious tuberculosis and also all of the hepatitis and everything, and nobody protects us from that stuff.
Yeah.
We
Go
don't,
ahead,
we
Karen.
don't know who we interact with, but this is to me an opportunity for people to recognize what they don't have and what they need. A lot of us want and think we need more than we do. I mean, this is an opportunity for us to be resourceful. You know, I said the other day, we need to not waste what we might not be able to replace or readily replace, but also the value of having good credit, having cash on hand, protecting those things. But you say don't listen to internet rumors. Who can the African American community go to and listen to for resourceful, accurate, up-to-date information? I mean, you have a quote-unquote president, and I say use that term loosely, who was on the air that said, you know, there are people out here that are dying that have never died before. My God, how would that not scare you?
Ridiculous thing.
Exactly, but economically, African Americans, not everybody, and I don't need to make that a blanket statement, but we do need to recognize, you know, cash, credit, collateral. You have to be prepared.
They matter more in an
They
emergency.
matter more, but this should show you that they do. And while we do need to help each other, you know, we all need to be in the position to help someone less fortunate.
Go ahead,
You know,
Brandon.
Steve, I think this is an interesting time because how it relates to African Americans. I mean, outside of Detroit, when you're looking at cities like Highland Park, Inkster, River Rouge, these communities have been ravished long before coronavirus. And so I think, you know, what we're doing is it's highlighting the fact that, you know, even in times of need, I'm not sure outside of just the public health side, African Americans are really going to be affected economically because we've been affected for the last 20 or 30 years.
But maybe it gets worse, is I think the fear, Greg, is that this enhances those problems, and there isn't a ready set of solutions that people are willing to.
It might get worse, but at
indulge.
least we're going to start to address the fact that the majority of kids in the community only get meals at
Don't
school.
eat.
We
Absolutely.
need to address
But
that.
that ain't new. That ain't no new.
It needs to be
that ain't no
fixed.
new
That's
thing.
been going
We're
on.
old.
That way.
We've got to
It
solve
should
it.
not be that way. It should also not be where people have to go to work sick, mask their symptoms because they won't be paid.
'Cause they're not worried
People
that-
should
Yeah,
be
it is.
conscious
That's
of the
right.
fact that even if you get a carry out, you need to tip. These are people that are working. I mean, these are things that are coming to light. If corporations could be flexible in doing certain things now, they should exercise that flexibility earlier.
Right.
I go back to the water with the city of Detroit. I go back to the buses. I mean, we've seen all these compromises, and I know it's not a sustainable model, but exercise that flexibility to give people the opportunity to leverage their
But how
economic
can